Every morning, thousands of seniors stir chia into yogurt or smoothies, believing they are turning back inflammation with a single simple habit. But the reality is more nuanced, and there is a tweak that makes the difference. I am Dr. William Benson, and what you will hear is rooted in peer-reviewed evidence, meta-analyses, and randomized controlled trials, not marketing buzz. The studies rightly praise chia as a source of omega-3 and fiber, yet most people see only modest change because the active compounds struggle to reach the tissues where they calm chronic inflammation. Today, I will show why that happens at the molecular level and reveal a practical mix you can prepare in minutes that improves bioavailability and clinical effect. If you are a senior coping with persistent joint stiffness, elevated CRP, or days of brain fog, this could be the change that reduces markers and eases daily life. If this is your first time here, subscribe to stay on top of evidence-based protocols and tell us in the comments which city you are watching from. Now, let us unpack the science behind chia and the precise addition that multiplies its benefit before I give you the recipe you can use tonight. Chia contains alpha-linolenic acid, a plant source of omega-3 that can convert partially to EPA and DHA. And it also brings antioxidants and soluble fiber that influence gut health. Meta-analyses have shown modest reductions in markers of inflammation when plant-based omega-3 is consumed regularly. But conversion rates to EPA and DHA vary widely between individuals and are often low in older adults. Randomized controlled trials published on PubMed and reviews from major universities indicate that absorption and incorporation into cell membranes is the bottleneck. Mechanistically, chronic inflammation is mediated by NF-kappa B signaling and circulating cytokines. And when insufficient EPA and DHA reach membranes, the downstream suppression of those pathways is limited. A 2019 meta-analysis led by researchers at Stanford and another review from University of Oxford noted that cofactors such as fat in the meal and certain emulsifiers dramatically alter absorption. Laboratory studies from the University of Milan and clinical work cited on PMC suggest that combining particular lipid carriers with plant-based omega-3 increases plasma EPA by clinically meaningful percentages. This is not conjecture, it is evidence-based, and it explains why a spoonful of dry chia alone often underdelivers. The problem is analogous to locking medicine in a safe and throwing away the key. Chia seeds encapsulate oil in a matrix of mucilage and fiber, which is beneficial for gut transit but reduces immediate release and absorption in the small intestine. Older adults tend to have slower gastric emptying, lower conversion enzymes, and often take medications that modify lipid metabolism, so the net effect is that active molecules never get to the inflammatory sites. Data from RCTs show that when seeds are merely swallowed whole, the increase in circulating omega-3 is minimal compared with ground chia or chia delivered with a complementary lipid. That explains why many caregivers and patients report little change despite daily use. The good news is that the limitation is solvable with a simple food science principle and supportive clinical evidence, which I will now reveal. Before that, I want to pause and hear from you because your experiences help shape practical research translation. If you have tried chia for inflammation, tell us in the comments starting with yes or no and add how long you have been using it. If you have not tried it, type no and say whether you use other supplements. Your short reply helps us map real-world outcomes and guides which protocols we test next. Many viewers will write yes and 2 to 3 months. Others will write no and mention arthritis or cardiovascular concerns. We read every comment and we compile patterns to compare with published RCTs, so your input matters. Share where you live to help us understand regional dietary differences and whether access to fresh ingredients is a barrier. We use this feedback to invite experts to future episodes, so your voice directly impacts research translation. Thank you for sharing. Now let us return to the mechanism and the mix that changes the equation. The discovery is surprisingly straightforward. Combine ground chia with a small amount of emulsified fat and a turmeric extract standardized for curcumin with a cofactor that enhances curcumin absorption. Why turmeric curcumin appears here is because curcumin is a potent antioxidant and NF-kappa B modulator, and it displays synergy with omega-3 in several preclinical studies and in at least one small RCT. Curcumin plus omega-3 reduced protein C reactive more than either alone. The role of the emulsified fat is to create a microenvironment for oil droplet formation, which improves intestinal absorption of alpha-linoleic acid and curcumin. Components I will name are extra virgin olive oil, high in monounsaturated fats, a fractionated fish oil containing EPA, DHA for those who prefer a direct marine source, and a standardized curcumin formula with a bioenhancer such as piperine or a phytosome formulation. Studies from Harvard and a randomized trial at University of California, San Francisco have reported improved markers when curcumin is provided in an enhanced formulation together with a lipid carrier. How does the synergy work at multiple levels? First, in the gut, the emulsified fat helps form micelles, so alpha-linoleic acid and curcumin are more readily incorporated into enterocytes, increasing absorption. Second, in the bloodstream, plasma lipoproteins carry more omega-3 and curcumin, bound to albumin, reaches tissues. Third, at the cellular level, EPA and DHA integrate into membrane phospholipids, replacing arachidonic acid, and thereby shifting eicosanoid production toward less pro-inflammatory mediators. Meanwhile, curcumin attenuates NF-kappa B activation and scavenges reactive oxygen species, so the two act in complementary pathways. Imagine a lock and two keys, one that unlocks access and the other that calms the alarm system. Together, they permit the benefit to reach the organ level. These mechanisms are supported by biochemical studies and small clinical trials that tracked changes in CRP, interleukin-6, and oxidative markers. Now the practical protocol that seniors and caregivers can use tonight. Ingredients, exact measures, and method follow. Ingredients per daily serving. 1 tablespoon ground chia, about 15 grams. 1 teaspoon extra virgin olive oil, about 5 milliliters. 300 milligrams of a curcumin extract, standardized to 95% curcuminoids with 5 milligrams piperine or an equivalent phytosome formulation. 15 milliliters of full-fat yogurt or kefir for probiotics, optional. 50 milliliters of warm water or unsweetened almond milk, and a 1/4 teaspoon of lemon juice for flavor. Preparation. Grind chia in a small spice mill until you smell a nutty aroma and see a uniform powder. Then mix the ground chia with the olive oil and warm liquid. Whisk briskly until a smooth emulsion forms. Then stir in the curcumin and yogurt if using. Let sit for 5 to 10 minutes so mucilage softens. Consume with a meal that contains some protein. If you prefer marine omega-3 instead of plant-based, use 500 milligrams combined EPA-DHA in a triglyceride form, taken at the same meal. Storage. Keep ground chia in an airtight container away from light and heat, and use within 2 weeks for optimal freshness. Taste, texture, and sensory notes. You will notice a light nutty scent from the ground chia, a silky mouthfeel from the emulsified oil. The warm liquid will release aromatic citrus from the lemon, and the curcumin may add a faint earthy bitterness that blends into the yogurt. Listen for the soft whisking sound as the emulsion forms and notice the slight smooth resistance when stirring. The temperature should be warm, not hot, so the curcumin remains stable and the yogurt retains live cultures. A short dialogue will illustrate real user interaction and clarify practical concerns. Dr. Benson speaking to Maria, a 72-year-old trial participant. Maria tells me, "I feel stiffer in the morning, but I tried chia and nothing changed. I want to understand why." I ask Maria, "Did you grind the seeds and eat them with fat, or did you sprinkle them dry?" Maria answers, "I sprinkled them dry on cereal for months." I say, "That explains it, because the seeds were not releasing their oil efficiently. Did you have any side effects when you switched to the emulsion?" Maria replies, "The first week I noticed a warmer taste and less creaking in my knees. By week 3, I had more energy." I ask, "What else changed in your routine?" Maria says, "I drank more water, slept a little better, and cut back on late-night snacking." This conversation shows the interplay between simple habit changes and targeted formulation. Precautions and contraindications are essential. Curcumin and interact with anticoagulant medications and increase bleeding risk, particularly with warfarin and some direct oral anticoagulants. So consult your physician. High doses of omega-3 can also affect bleeding risk and may interact with certain blood pressure medications. People with gallbladder disease should be cautious with supplemental oils, and those on immunosuppressants or chemotherapy must check with their oncologist. If you are diabetic, monitor blood glucose as changes in fiber and fat intake can alter postprandial levels. Pregnant and breastfeeding women should seek medical advice. Quality matters. Choose curcumin products tested by third-party labs and omega-3 that report EPA/DHA content per capsule, and avoid oxidized oils indicated by rancid smell or dark oily appearance. 2 moments of tension occur in many stories and are worth pausing on. The first moment happens when a trusted supplement fails to deliver and doubt sets in. It feels like time wasted, trust erodes, and the person considers giving up entirely. In that pause, it is tempting to dismiss science as inconsistent, yet the right next step is to interrogate form and delivery rather than abandon the ingredient. The second moment comes when a new combination works, but a side effect or unexpected interaction appears. The choice becomes continue with benefit and risk or stop and lose progress. In that decision, careful consultation with a clinician and monitoring of biomarkers such as CRP and liver enzymes is crucial to navigate the trade-off. What you can expect and a realistic timeline. In week 1, you may notice subjective shifts, reduced morning stiffness, slightly improved digestion, and a smoother bowel pattern as soluble fiber and emulsified fats change transit. In weeks 2 to 4, measurable shifts in markers such as CRP and interleukin-6 may appear, small but meaningful, especially in those with elevated baseline inflammation. By 8 to 12 weeks, more robust changes in EPA, DHA incorporation, and symptomatic improvements in pain, fatigue, and mood have been reported in trials. If using marine omega-3, improvements in joint tenderness and functional scores frequently show up around the 3-month mark in randomized controlled data. Summary and call to action. To bring this home, the simple habit of mixing ground chia with a small emulsified fat and a bioavailable curcumin changes the bioavailability landscape and aligns with evidence from meta-analyses, RCTs, and biochemical research. Try the exact protocol described daily, with attention to quality and medical supervision if you take medications. If this analysis helped, subscribe for more evidence-based protocols and write yes in the comments if you tried this mix, or no if you plan to try it, and add how many weeks you will commit. Share this video with a caregiver or friend who manages chronic inflammation. Epilogue. Follow up at 1, 3, and 6 months to close the loop. 1-month check-in. You may report less morning creakiness, improved stool consistency, and a small drop in subjective pain scores. Record a baseline CRP if possible and repeat at 1 month to see early shifts. 3-month follow-up. Many users in small trials report a clearer pattern with reductions in CRP, interleukin-6, and improved functional tests. Continue to monitor blood work and consider a professional nutritional review to adjust doses and sources of omega-3. 6-month outcome. By half a year, some individuals transition from relying on supplements to maintaining dietary patterns that keep markers lower. The combination of consistent chia-based emulsions, higher EPA/DHA intake, and curcumin in a bioavailable form can sustain lower inflammatory set points in several cohorts. But remember, lifestyle factors, exercise, sleep, and medication management remain central. Close with a final thought. Small, consistent changes informed by science are what translate research into real life. Try the mix for at least 3 months. Document your markers and symptoms and come back to tell us how it went, because your results help refine what works for seniors everywhere.